Omicron. Joining me now to help all of us, including myself, better understand what exactly is going on here is Professor Peter Pitts. He's founder of Center for Medicine in the Public Interest, former FDA Associate Commissioner. Welcome to the show. So what exactly is at the heart here? What is the main issue going on here with this delay? What's happening?
Well, the issue is data. The two-shot data was not strong enough to protect these children. Pfizer is now looking at a three-shot regimen data set, which is going to be presented to the FDA once it's ready. And I'm sure that once that data is presented, the FDA will look at it quickly and completely, probably send it to an advisory committee. And if the data is good, move on to issue it an emergency use authorization, not an approval, but an authorization to use for children ages 6 months and up.
So can you help me better understand this? It appears as if the Wall Street Journal report concluded that because COVID-19 cases were low for as long as they were, it appeared as if the effectiveness of the vaccine was not as strong as maybe it was. Help me better understand what exactly they were looking at.
Sure. Well, obviously, it's kind of a variant to variant situation. The overwhelming majority of people in the U.S. right now getting infected with COVID-19 are getting the Omicron variant. It seems that the Pfizer data was against the Delta variant, which is fine, but we want to make sure that the vaccine works against the predominant variant right now, which obviously is Omicron. So going forward, the FDA wants to look at data specifically against Omicron, and it looks like that's going to be a three-shot regimen versus two, which was efficient against Delta, but not Omicron, because obviously Omicron is more infectious.
Peter, what does the timing look like for next steps to go through this data that they very much want to look at? I mean, I got to imagine This is to some degree a time-consuming process.
Well, you can't rush it. I mean, obviously, collecting the data is a time-consuming process. Reviewing the data is a time-consuming process. So what both sides, Pfizer, BioNTech, and the FDA have to do is have an all-hands-on-deck proposition. Once the data is ready, get down to it, make sure all the experts can look at it, make sure the advisory committee can look at it swiftly afterwards, and then have the FDA make a decision. So I would say, it all depends, so kind of from day one, once FDA gets a final data set, I mean, let's say it could be, as little as a week.
So what does this do with regards to parents? What do you tell parents that are sitting there, they're seeing all these headlines, maybe they feel as if there's been inconsistent guidance, and maddeningly so, they say, we said this, and then we said that, the data said this, and now it says that. What do you do if you're a parent there with regards to finding information that makes yourself confident that you're doing what's best for your child or your best in your family? Because I think even the best intentioned person out there at some point has been confused about a lot of the information that's been shared. I think that's fair.
It's totally fair. And, unfortunately, the government doesn't seem to be able to communicate its way out of a paper bag. I think, the single simple message is follow the science. And science is hard, but we're doing the best that we can. We're working as quickly as we can to reach a good decision based on science. Now, the real problem is this is going to further confuse parents for children ages 16 and down as to what to do, because that cohort, teenagers down to age 5, I think you only have about a 15% vaccination rate, which is dismal. We've got to do a better job. And my fear here is that the confusion about young children, 6 months to 5, is going to further confuse parents of older kids and have them wait, which is a dangerous proposition.
What are we seeing right now with regards to children contracting COVID-19? What are the numbers and what are some of the stories indicate to us about where we are in this fight?
Well, the first thing is that, for children, the vaccine works as it does for adults, and it works this way. It doesn't make anybody immune forever. That's not what vaccines do. That's been a communications mistake by the government from the beginning. What it does say that if your child does get ill, their symptoms will be mild and they will be less infectious to others. So it reinforces the value of vaccines to protect your child and to have everybody else protected from your child. So it's a community effort, not just what my child is going to do. I think the message to parents is, if you have questions about the COVID-19 vaccine, go talk to your pediatrician. In fact, the government needs to have a communications effort and outreach effort to pediatricians to make sure that they're part of this effort too. That hasn't happened. That's got to be, I think, the top of the president's agenda. Reach out to pediatricians, get them on board, convince parents to get their children vaccinated. And I think that the more older children get vaccinated, the more likely it is for younger children, for their parents to want their kids to get vaccinated as well.
We're finally, in a long overdue sense, perhaps, here, Peter, having this conversation about so-called long COVID and the effects in adults. I think for many people like myself who previously have gotten COVID-19, you get sick for a couple of days, and luckily, hopefully, you're back on your feet pretty soon, as I have been both times. That's not the case for every adult who gets it. There are lingering symptoms very severe ones at times that can linger on for many days, many weeks, months down the line. What do we know with regards to long COVID's impact on young children? I really feel as if this is a part of the conversation we're not having enough of. Is there any data to suggest what that looks like?
There's very little data. A lot of it is anecdotal. And of course, the plural of anecdote isn't data. So we can't rush to conclusions. But the truth is that for the first variant of COVID-19, certainly probably for the Delta variant, people with long COVID will have different types of long-lasting symptoms. We don't know if it's perpetual. We don't know if it's going to end after 6 months, after a year. We've got to do a lot of serious science and collect a lot of data. And that's going to take cooperation between government and academia and physicians and patients. We've all got to be in this together to make sure we can get the data so we understand what the problem is. And that's really the first step to solving the problem.
You know, I've covered national politics for many years, Peter. The phrase "a plural of anecdote isn't data" is the thing that I wish every single American voter understood as it pertains to better understanding stories of national political importance. So thank you for that. I am out of time here, but real quick, what's your sense on the United States moving into a more endemic phase of this pandemic, maybe even this year?
I think we're absolutely going to get there probably in the spring. People need to quit the chicken littleism and recognize this is here to stay. We can deal with it just like we do with the flu. Relax, do the right thing. We can all get back to the next normal.
Do the right thing. Professor Peter Pitts is founder of Center for Medicine in the Public Interest, also former FDA Associate Commissioner. Happy Friday. Thanks for taking the time for a really important conversation.